For the fifth day running, the number of COVID-19 recoveries in the country has continued to outnumber new cases. Health Director General Tan Sri Dr. Noor Hisham Abdullah said the country registered 2,176 new COVID-19 cases, while 4,521 patients have been discharged. This brings the number of COVID-19 recoveries in the country up to 218,355, which is 81.9% out of the total number of cases. Cumulatively, the country has 266,445 cases since the start of the pandemic. The 2,176 new cases is the country's lowest daily figure since January 5th, before the second movement control order was implemented on January 13. It is also the second day in a row of new cases dipping below 3,000. With recoveries outpacing new cases, the number of active cases went down to 47,135 on Monday. The number of patients in intensive care units is currently 260, with 112 on ventilator support. Dr. Noor Hisham said Selangor continued to record the highest figure out of all states, with 910 new cases, or 41.8% of the country's total. Dr. Noor Hisham also announced 10 new deaths to COVID-19, of which 5 are in Selangor, 2 in Kuala Lumpur, and 1 each in Sabah, Johor, and Perak. All the deceased are Malaysians aged between 57 and 91. Meanwhile, the Health Ministry has uncovered 13 new COVID-19 clusters, making the total active clusters up to 489 nationwide. Of the 13 new clusters, 10 are linked to outbreaks in workplaces. Most of them were discovered from targeted screening exercises on workers of factories, supermarkets, and construction sites. One new cluster linked to a nursing home in Kajang, Selangor, was found to have 24 positive cases. Named the Jalan Cheras cluster, the outbreak is traced to a 39-year-old man who developed symptoms on February 6 and tested positive on February 15. Meanwhile, 8 clusters in the country has been classified as closed after no new cases were recorded in 28 days straight.